Malaria is famous the world over, and even more so in Africa for a good reason. It's one of the continent's biggest killers. A disease transmitted to humans by a mosquito called the female Anopheles, it is mainly found in tropical countries. According to the latest World Malaria Report 2022 published by WHO, the World Health Organization, there were 247 million cases of malaria in 2021 compared to 245 million in 2020. The estimated number of deaths attributable to the disease was 619,000 in 2021 compared with 625,000 in 2020.
Entre l'an 2000 et 2021, nous avons
Between 2000 and 2021, we have seen remarkable progress, a reduction of almost 30% in the number of cases and almost 60% in malaria-related deaths. However, if we look back to 2015, we can already see that progress has slowed alarmingly, because we haven't seen that drop that was recorded before 2015.
Vu cette baisse qui a été enregistrée avant 2015.
The WHO African region bears a large and disproportionate share of the global malaria burden. As recently as 2021, children under the age of 5 accounted for around 80% of malaria deaths on the continent. Efforts to combat this nebulous disease are struggling to satisfy the many obstacles that stand in the way.
La plupart des pays,
Most countries have programmed interventions, but when you look at the strategic plans, most are only 50% funded. So there are a lot of services that haven't been carried out because of funding shortfalls.
Des insuffisances de fonds.
To overcome this handicap, in 2021, the EcoBank Group, through its foundation, in collaboration with the RBM Partnership to End Malaria and Speak Up Africa, launched Zero Malaria Companies Commit initiative. Today, the initiative is being implemented in Benin, Burkina Faso, Senegal, and Uganda, and is currently being launched in Ghana. Among other things, it aims to mobilize national resources for sustainable financing of the fight against malaria.
L'objectif de cette initiative,
The aim of this initiative, as its name suggests, is to mobilize and engage African private sector companies in the fight against malaria. It's a part of a more continental movement that was launched in 2018 and endorsed by the African Union a few years later, called the Zero Malaria. I'm committed. And the idea is really to be able, as part of this initiative, to strengthen the third pillar, which is the commitment of the private sector. We want to mobilize all our networks to contribute to this undertaking, in particular all our commercial banking customers, small and medium-sized enterprises, and give them a place in the fight against malaria.
Dans la lutte contre le paludisme.
And in this drive for an effective response to malaria, the EcoBank Group is working closely with Speak Up Africa, a non-profit strategic communications and advocacy organization dedicated to catalyzing African leadership, driving policy change, and raising awareness around sustainable development in Africa.
Aujourd'hui, nous travaillons à travers le
Today,
continent africain.
we work
Donc,
across
nous avons
the
des
African
partenariats
continent.
stratégiques avec l'Union
We have
africaine,
strategic partnerships with the African Union, with the West African Health Organization, but we also have programs in 7 African countries, mainly French-speaking countries. In Ghana and Uganda, for example, we have a program in the fight against malaria, which we are implementing.
This collaboration supports malaria risk communities across the continent by advocating stronger political will, increased endogenous funding, and more targeted malaria elimination strategies.
For us, it was important to be able to set up a program that would mobilize all stakeholders. Today, we have a campaign called Zero Malaria, I'm Committed, which is a campaign of the African Union and the Global Malaria Partnerships, and which calls for political commitment, private sector commitment, and community commitment. Today, more than 50 companies have mobilized across the 5 countries where the initiative is being implemented, namely Benin, Burkina Faso, Ghana, Senegal, and Uganda. More than 50 companies have contributed 1.5 million euros in addition to the 600,000 contributed by the Foundation and EcoBank.
In some African countries, malaria reduces GDP growth by up to 1.3% and places a heavy burden on private sector businesses. The disease continues to affect corporate profits across the African continent and beyond through employees' absenteeism, lower productivity, and higher benefit costs. Thanks to the Zero Palu Companies Get Involved initiative, a number of financial and in-kind resources have been mobilized in all 5 implementing countries.
Aujourd'hui, l'approche est une approche
Today, the approach is participatory, inclusive, and in support of national strategies, and the EcoBank Group is making available its entire network of partners and platforms in these countries, giving us access to private sector companies that want to contribute to the fight against malaria. And we at Speak Up Africa and the National Malaria Control Program, which is a Ministry of Health program, are looking within the framework of existing strategies at how the private sector can get involved at what level, in what program. And we are making sure to build bridges so that the private sector's contribution can support the efforts of the National Malaria Control Program.
Du Programme national de lutte contre le paludisme.
Il y a les contributions financières, bien sûr, mais après, beaucoup d'entreprises, on a travaillé avec elles pour
There
pouvoir
are
identifier des
financial
choses qui sont faciles à faire
contributions,
pour elles
but
en
after
termes,
many companies,
en termes
we
de
work
trésorerie
with
ou
them
par
to
rapport à leurs
identify
différentes
things
parties
that might
Donc,
be
par exemple,
easier for
au
them to
Burkina
do
Faso,
in terms
on a
of
une
cash
entreprise,
flow or
qui est
in
spécialisée
relation to their various
dans les
stakeholders.
équipements
For
médicamenteux,
example,
qui a
in
fait un nombre
Burkina
de 100 000
Faso,
de
we
100
have
000
a company
tests de diagnostic gratuits,
specializing in medical
qui vaut à peu près à
equipment,
30 000 $,
which has donated
au Sénégal,
100
on a
rapid
une
diagnostic
chaîne de
tests
télévision
at the
qui a,
cost
elle,
of
décidé de
around
diffuser gratuitement des spots
$30,000.
de sensibilisation
In
de lutte contre le
Senegal, a
paludisme.
television
Au
channel
Bénin,
has decided to broadcast a
une
free
entreprise de
awareness
télécommunications
raising
de diffuser
spots
gratuitement
on the
des
fight
spots
against
de
malaria.
sensibilisation de lutte contre le
In
paludisme.
Benin,
Au
a
Bénin,
telecommunication company has
une entreprise de
agreed to send
télécommunications
SMS
qui a
messages to its
accepté de
customers'
diffuser
telephone
des
numbers.
SMS, d'envoyer des SMS à ses numéros de téléphone, à ses clients.
Malaria is a major health problem in Senegal. It is endemic with the seasonal upsurge. It accounts for around 35% of consultations. To date, significant progress has been made in implementing various aspects of the National Malaria Control Program. The program has also adopted the Zero Malaria Initiative.
Plus de 500 et quelques millions ont été mobilisés, mais en nature.
Over 500 and some millions have been mobilized. We've had quite a few companies get involved, particularly Canal Plus and then Econs, which is a construction company, but also AM Gold, which is a mining company in the Kédougou region.
qui est dans la société minière, qui est dans la région de Kédougou.
L'implication de Canal+,
The involvement of Canal Plus in supporting Speak Up Africa is part of our social responsibility program, which is called Canal Plus Impact. In this program, we have a section called Au moins une cause, which means in English at least one cause. In this program, we highlight causes that are important to society, and it's in this context that malaria was chosen, in particular with our partner Speak Up Africa, with whom we've been working for several years now on the fight against malaria. We are well aware of the importance of this scourge for our population and of the ambitions we have in terms of the fight against malaria in Africa in general.
Sur l'Afrique de manière générale.
The television channel has chosen to support the Zero Malaria initiative by broadcasting preventive commercials on its channels.
Le fait d'exposer le plaidoyer pour
Exposing malaria advocacy on our airwaves enables us to reach millions of people, both in Senegal and across Africa. It's important to have people carrying the message, but it's also important for us to help relay these messages deep into the country to reach the maximum number of people.
des pays puissent toucher le maximum de population.
A commitment welcomed by the coordinator of the National Malaria Control Program.
Le secteur privé
The private sector has a big interest in eliminating this disease, which can have repercussions on their businesses. I'll give the example of a large private national company working in cotton. If the workers in the Tambacounda region are not healthy, they cannot produce well. It's a win-win partnership.
gagnant-gagnant.
Heading towards Medina Yorofula, a department located in the Kolda region in southeastern Senegal. It's one of the regions where most cases of malaria occur. We are in Sare Haruna. In this village, where thatched roof houses cohabit with ubiquitous vegetation, a man on a bicycle is doing some combing. He is what is called a desdom, a French word for a home care provider. There are 214 in the department. These are community workers chosen from the population under certain conditions. They are trained to treat non-severe cases of certain diseases such as malaria and diarrhea. In his open-air clinic, Mohamedou unpacks his equipment supplied by the department's health district. This is where the village's sick come for consultation. My role is to manage cases of malaria in the village. Every morning, I go house to house to detect cases of malaria. For those who have symptoms of the disease, such as fever, I give them a rapid diagnostic test. If it's positive, I give them medication and manage the case locally. If it's not serious, if it's negative, I refer the patient, because that would mean the patient is suffering from another illness that needs to be managed by the Medina Yorofula Health District. But beyond the sweep, people with malaria come here to be consulted on the spot. As you can see, in addition to malaria, I also manage cases of mild pneumonia. And when there are signs of seriousness, I refer the patient. Mamadou's work was facilitated by a donation of bicycles from a private company involved in the Zero Malaria initiative. I manage 4 villages. The distance between villages are over 1 kilometer. I used to walk these distances, but since I've got the bike, it's easier, especially in the rainy season. Before I went out to rake, the patients would wait a long time. Sometimes I had to turn back to deal with serious cases. It was very complicated for us desdoms. Now with my bike, I save time. I can get around the villages more quickly by bike, and it has made my job as a desdom a lot easier. A total of 30 bikes have already been handed over to the department's home care providers. A further 60 will be delivered over the coming month. A few kilometers from the village of Sare Haruna in the Medina Yorofula Health District, Dr. Serigne Modou is delighted with the contribution of DESDOM activities, which have relieved congestion in the health district and made life easier for the population.
À chaque fois quand j'ai l'occasion quand même de les rencontrer, de les visiter, de faire des supervisions, je les remercie beaucoup.
Every time I have the opportunity to meet them, to visit them, to do supervisions, I thank them very much in a way. We are health workers and they are currently doing work that we are supposed to do. But they are taking on cases at home and cases for other illnesses. Normally, all these charges should fall to us because we're there as health personnel. We're supposed to take on all the cases of illness we receive in the department, and we work with these DESDOMs who are very involved at community level and who make it possible to avoid certain journeys by the population to come for a consultation.
La majeure partie, 70% des cas de palud simple, sont pris donc en charge à domicile par ces deux hommes-là.
The Medina Yorofula district comprises 24 health posts and 5 rural maternity units. This year, the area has seen a marked reduction in malaria cases compared with previous years. This is thanks to the involvement of public authorities in the private sector.
Ici, quand même, au niveau de Medina Yorofula,
here in Medina Yorofula, we have many partners who support us in the fight against malaria and in other health programs. In addition to the PNLP, we have partners such as Econs who have given us a great deal of support by providing bicycles to our DESDOMs and home care providers. To date, major achievements have been made in implementing the various components of Senegal's National Malaria Control Program, which is now supported by the commitment of the private sector. In many sub-Saharan African countries, malaria is a real health problem, as it is in Benin. It is the leading cause of hospitalization in the country's hospitals and the leading cause of death among children under 5 and pregnant women. In 2021, the incidence of malaria was 21.2% in the general population, with a rise to 42.6% in children under 5. In the same year, over 2 million people contracted malaria in Benin, resulting in 1,914 deaths. There was therefore a real need for advocacy to mobilize domestic resources to close these gaps. Aware of the urgency of eliminating malaria in the country, the Honorable Ake Natonde, member of the National Assembly of Benin and school promoter, joined the Zelo Malaria Initiative of the EcoBank Group in Benin. He urged students at his schools to get involved and support the cause.
J'ai mobilisé les apprenants de HECM à
I mobilize HECM students to contribute money to support the Zero Malaria Fund. And in just a few months, with their contributions, however modest, HECM students were able to mobilize a sum of 1,700,000 CFA francs, which were paid into the fund.
Qui ont été versés dans ce fonds.
But the efforts don't stop there.
Nous avons mobilisé.
We've mobilized the deputies in the National Assembly and we've made the government aware of the issue every time it comes before us for budgetary health-related debates.
Budgétaire ou de débats relatifs à la santé, le paludisme a toujours été au rendez-vous.
We've always taken the opportunity to bring everyone together through workshops too. We've been able to hold workshops that have brought together around 20 MPs who have been sensitized to the cause and who, during debates, take up the cause of malaria.
Qui pendant les débats portent la cause du paludisme.
In August 2022, for example, the national budget's contribution to the fight against malaria in Benin for the year 2023 was increased. Indeed, this amount has risen from an average of the last 3 years of over 1 billion francs CFA to over 2 billion francs CFA for the 2023 budget year. To further support the Beninese government in its effort to combat malaria, Ecobank Benin, in collaboration with the Ministry of Health through the National Malaria Control Program and Speak Up Africa, organized a mosquito net distribution operation in Ganvier. Ganvier is a lakeside town in southern Benin, located on Lake Nokwe, to the north of the metropolis of Cotonou. It is part of the commune of Soava in the Atlantic Department. This charming floating city, with its houses built on stilts, was the setting for the donation ceremony. The event was attended by members of the parliament, local and communal elected representatives, health authorities, technical and financial partners, business leaders, professional organizations, and representatives of civil society in the presence of the media. Through this operation, Ecobank aims to encourage the private sector to join the fight against this preventable and treatable disease.
Aujourd'hui, nous sommes en train de
Today, we're living through an event. It's true that we live through this kind of events, but today's is special because there are a lot of companies that have got together with the agreement of the Beninese state health authorities, organizations that have decided to support the community with a very large batch of mosquito nets for school children, especially children from CE to CE, mothers and children from 0 to 5 years old. It's an operation we've just completed, and my impressions are very good because there are a lot of people interested in us, especially companies. Today, they are interested in the life of the Sova communities.
à la vie des communautés lacusses de Soava.
The first stop on the impregnated mosquito net distribution tour was at the Ganvier Health Center, where pregnant women and mothers received theirs, as well as raising awareness of hygiene and malaria in households.
The mosquito net will not only help us fight malaria, it will also help us save money, because if the children don't get sick, we will have less to spend. My deepest thanks go to Ecobank and all the partners who have contributed to providing us with the mosquito nets today. It will really help us. I think the best thing is for us to pull together. Thank you.
After the parents, it was time for the children to receive their kits. In the schools, the learners were impatient for some, overjoyed for others. The donation of 2,500 mosquito nets was intended for school children in public primary schools, pregnant women and mothers of children under 5 who frequent both the health center and the Ganvier floating market. At the latter stop, shopkeepers were abuzz with activity. This operation supports the efforts of the Ministry of Health in its strategy of distributing routine impregnated mosquito nets to vulnerable targets.
Quand on est ensemble, on fait beaucoup de choses et on pose.
When you are together, you do a lot of things and you take a big step. That's what we're doing today. The Ministry of Health launched an appeal to companies and international organizations to get together and go into villages and remote areas to help people with community health. That's what we're doing today. I think you always have to work together. Working alone doesn't achieve anything, but when we get together, I think we can achieve a lot.
Ça ne donne rien, mais quand on se met ensemble, je crois qu'on fait beaucoup de choses.
In both Benin and Senegal, the implementation of proven effective interventions has resulted in improved access and quality of care, acceptance of long-acting impregnated mosquito nets as a useful means of prevention, and the use of intermittent preventive treatment for pregnant women. Greater involvement of the private sector in the fight against malaria could thus push the waves of disease elimination towards an open sky and a better tomorrow for the continent's populations.